Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Welcome to the Brain People Podcast. My name is Jonathan Eanes. I'm a psychiatric PA. I will be the host for today's episode. And joining me is one of our regular co-hosts.
I'm Dr. Daniel Binus, and I'm a psychiatrist.
And we've got a definitely an interesting and very relevant topic for today. We'll be talking about cannabis and its role and effect on mental health. So I guess to get us started on this particular topic, Dr. Binus, obviously cannabis is a pretty hot topic in mental health. Can you give us an overview of why this conversation is so important today?
Yeah, basically, I've noticed in the last several years, and particularly in my not super long career, but in my psychiatric career, that more and more people, it seems like, that are coming to me are using cannabis, and they often wonder, is this actually helping my mental health or hurting my mental health? Or maybe they don't wonder that, but I wonder that. Because I'm seeing that they're coming in struggling with perhaps anxiety, depression, suicidal thoughts, psychosis. And so I'm wondering, okay, is this helping or hurting? Because there's so much information out there that actually tries to claim that cannabis is almost like this panacea, that it's a cure-all, that it will help my pain, it will help my sleep, it will help my anxiety, my focus, and all of this. And so the question becomes, is that actually based on good data, or is that just propaganda?
Propaganda, yeah. I know you had some statistics you wanted to share with us, and some trends that we have sort of played out, not just in sort of clinical anecdotal practice, but also also based on research.
Yeah, so basically, just to start understanding and appreciating some of the trends that we're seeing in cannabis / marijuana use. I mean, we'll use the terms interchangeably here. Basically, in the United States, recently, we have about 15% of adults in the United States have used cannabis in the last 30 days. Okay. So that's in the last 30 days, 22% in the past year. Now that's all adults, any adult over 18 and over. But what's really interesting to me is that we see a significantly larger percentage when we look at the 19 to 30-year-old range. And so in that range, that age range, we actually have roughly 42% of people, so nearly half of that age group have used in the past year, and 29%, or nearly a third, in the last 30 days, and about 10%, 1 in 10, daily users of that age group. So again, we can see that the prevalence rates are actually quite substantial for cannabis.
And what sort of impact would you say that legalization has had on usage trends and public perception?
Yeah, that's a great question. And research actually shows that there's quite a curve that has been kind of this exponential growth curve after legalization started to take place. Because we know that there was no legalization of cannabis until 1996. California is always a front runner at the cutting edge, and we definitely didn't disappoint in this respect. In 1996, California was the first state to actually legalize medical use of cannabis. And so since then, it's kind of spread across the United States, and basically now we have 39 out of the 50 states have legalized cannabis for medical purposes, and 24 states are now legal for even recreational use. And so we've seen a big uptick in the general use of cannabis and the perception that it is safe and perhaps even helpful for health and for mental health and even for physical health, things like pain management, etc.
I know we'll obviously get into a conversation about its relative helpfulness and risks that are associated with it, particularly in the context of mental health. But I know you had some comments about the cannabis industry and the influences of the industry and on the general population and so on. So I was hoping you could share a little bit with us.
Yeah, one of the interesting things that we've seen is the growing amount of dollars involved here. And a lot of times when we look at trends and even when we look at science and this sort of thing and messages that people are getting and potentially even misinformation or false information or propaganda or whatever you want to call it, we have to ask ourselves, why is this happening if it is indeed misinformation? And a lot of times we can just follow the money, And it's a very similar sort of story. Back in the 1960s and 1970s, you had a very similar story with big tobacco, where there were studies, even scientific studies, and there were a lot of articles and a lot of influence in even the medical field to say, you know what, smoking, not that bad. And in fact, I mean, at one point, they were even saying, yeah, maybe it could actually help your lungs to, have breathe in some big, nice puffs of smoke or whatever. And, now we look back and we say that's ridiculous. But, back then, there was a lot of misinformation. There was a lot of propaganda. Why? Because they were trying to cover up data that showed the harms of it because of the money, right? And so we're also seeing, I believe, a lot of that unfair or skewed data because right now, for example, in 2025, the estimate is that cannabis industry is going to be about $45 billion. And that's quite a large amount of money. And it's only slated to grow. So 2026, they're estimating approximately 50 billion, 2027, 53.5 billion, and 2028, 56.9 billion. So again, there's a lot of money in this industry. And especially, with legalization nowadays, this also even allows, and I'm not trying to be a conspiracy with the government and all of that, but it's interesting because now the government even has a stake because it's taxable, right? And so we can see that there is some degree of incentive to have some positive messaging around cannabis because of the money. And so we have to be really careful to try to look at the best data and try to be objective with that. One other aspect that I think we need to be careful of too when we're looking at the data, and if you're a cannabis user or maybe somebody that is a cannabis user, there is going to be that bias to say like, okay, you know what? Let me try to find, we call it confirmation bias, right? Let me try to find data that actually supports my viewpoint, data that will make it easier to rationalize my continued use, because for most people that are using, they like it for a reason, and so they want to keep using. And so it's easy to just look at one side, to look at, okay, I want to just listen and hear stuff that is going to support that use. I just want to look at data that actually is positive when it comes to cannabis. And so if you're, one of those individuals, I would challenge you to listen to this episode to its conclusion, because I hope that at least it will give a little more of eye-opening to kind of look at the big picture. And ultimately, we all got to make the decision whether to use or not, but at least you're more informed in the process.
Yeah, and one thing I would clarify, especially for those that haven't really listened to our our podcast before that may be coming into this conversation, because I can hear people's sort of skepticism. One comment I would say is, just because there's a lot of money behind something doesn't inherently make it like bad. It just means that the incentive structure may be sort of misaligned, and so that's one consideration. The other consideration is, you mentioned $45 billion for cannabis. The pharmaceutical industry obviously is much larger than that, and so there's a lot of the same sort of skepticism that we have about the pharmaceutical industry as well, right? So this isn't to throw shade specifically on cannabis by itself in that industry. It's just really to, as a general rule of thumb, when there is so much money behind something and something is funded by certain interest groups, your sort of alarm bells should go off, and you should look at things with a healthier degree of skepticism.
Yeah, no, I really appreciate you pointing that out, Jonathan, because we need to be fair with that, and that's where we need to, of anything where there's a lot of money involved, we need to have a healthy degree of skepticism, and that's, I think, the main point that I'm wanting to bring out. I'm not saying that money is the root of all evil, and anything that's associated with money is evil. No, even the Bible says the love of money is the root of all kinds of evil, right? So I
Let's
appreciate that.
let's talk about the neurobiology of cannabis a little bit. So what happens to the brain when somebody consumes cannabis? I know there's sort of different elements to cannabis that people tend to emphasize. So can you walk us through just kind of a basic understanding of how it impacts the brain?
Sure. So basically, you have cannabinoid receptors called CB1 receptors, which respond to what we call endocannabinoids and THC. So endocannabinoids are actually cannabinoids that our own body, our own brain manufactures. And the primary one there is anandamide. So in reality, our brain actually makes its own cannabis. And that's why we don't need to worry so much about growing it, right? And so it's interesting. Naturally, we have cannabis in our bloodstream, well, an endocannabinoid, we might say. And these receptors, again, they not only respond to the internal natural occurring anandamide that our bodies make, but also THC and other related cannabinoids. So these CB1 receptors are widely distributed in the brain, including areas that control attention, decision-making, motivation, and even memory. And the interesting thing about this is that as they're widely distributed through the brain, they actually influence pretty much all of the major neurotransmitter systems, like the serotonin system and the norepinephrine system and the dopamine system. And the way I kind of look and think about the natural role of the cannabinoid system in our body is that it's basically like this fine-tuning sort of mechanism that the mind actually and the body can use. In other words, if there's a neurotransmitter system that's maybe not firing quite enough, then the cannabinoid system can kind of fine tune that so that it will like to maybe increase or decrease the cannabinoid stimulation there, so that system will actually fire stronger. And then vice versa. If there's a certain system in our brain that's firing too much, the cannabinoid, by finely tuning that and adjusting it, it can actually downregulate. And so that fine tuning seems to be a major effect and reason that the cannabinoid system is actually helpful and important. And again, because it is widely distributed in the brain and even in the body, we know that it has a big effect, and that's part of why it affects things like attention and memory and motivation, and also, dare I say, that it even can become addicting.
Trigger warning. Anything else you want to share about the neurobiology or the physiology of endocannabinoids or cannabis specifically?
No, I mean, I think the only other thing that I'd say is that, when we use exogenous, meaning like we use cannabis that is not naturally from our own body, that actually messes with the internal natural system, and it loses the ability to have that fine-tuning effect. And it actually, starts downregulating the natural cannabinoid receptors in our body, in our brain, so that our body becomes, in a way, you might almost say, like a bit resistant to the natural effects of our natural cannabinoids that are being released, the anandamide. And so that in turn makes it so that, once we start using cannabis regularly, we have to, just like any drug, we have to use more to kind of have that normalizing effect. Otherwise, we're going to feel kind of out of sorts.
Yeah, it sounds. And I know the effect of stimulating the cannabinoid receptors is different than that of, say, the GABA receptors, but it sounds like a very similar conversation. Where our body has sort of natural GABA that it can produce and create sort of an inhibitory effect, and then we can use exogenous substances like alcohol and in Xanax and Valium and things of this nature that can disrupt that system and impair our ability to self-regulate.
Yeah, absolutely. And, I wanted to speak just a little bit more to that whole addiction piece, because that goes, I think, right alongside even with the benzos and all of that. So how are benzos, like Xanax, Valium, or even alcohol for that matter, how are they addictive, even though they don't stimulate directly the dopamine? They're not like dopaminergic. Well, what we find is that there's a roundabout mechanism that all these potential drugs of abuse, and even like the benzodiazepines, like the Xanax, Valium, etc., can stimulate that dopamine pathway. It's not a direct, but it's a roundabout way of stimulating and getting that dopamine release. And so that's part of what makes them addictive, and that's the same reason that cannabis actually can be addictive too. And the statistics actually show that approximately 1 in 10 people who use marijuana will become addicted. And when people start before the age of 18, the rate of addiction actually rises to 1 in 6. So, back in the day when I was young, and when I was open-minded, you might say, to look at some of these things and think about some of these things, I actually was told that cannabis, hey, it's not that bad of a thing because it's not addicting at all. Now, I can tell you that the data is very clear on that. Now, we know that cannabis, in fact, is addicting. We know that there is an actual withdrawal syndrome that people experience, when they stop using cannabis. And we know that the other factors, when you think about, the increased tolerance and, the kind of that loss of control of, oh, I can't help myself, but I need to use. I know I shouldn't, but I really want to, and I'm just going to do it anyway. And that whole loss of control part of addiction, and the other aspects of addiction, like continued use despite negative consequences, and the poor insight about the effect of the drug on my life and my relationships and this sort of thing. All of those things are present. And so it has become very clear that cannabis is actually an addictive drug.
I know you wanted to talk about some of the research that we have behind or with cannabis, but particularly for mental health. And there's some confliction there. There's some ambiguity. There's due to the way that it was classified. There's been maybe not as much research over the course of the decades as maybe otherwise would have. And so I know you wanted to share with regarding some of those things.
Yeah, let's start a little bit by talking about the impact on general intelligence or cognition. And,
Okay.
The bottom line there is that we do have enough data that show clearly that cannabis can actually affect people's cognitive health and their intelligence quotient even. And so especially when people start at a young age and the brain is still developing, this can be very prominent. And there's some studies that show even up to potentially 8 IQ point drop when it comes to heavy consistent cannabis use, again, especially if it starts before the age of 18 in adolescence. And so I think it's really important that we understand that this isn't just even about the emotional health, which is clearly very important and I'm biased toward, but it's even about the development of our cognitive abilities, our intellectual abilities, and that, yeah, I mean, and a 6-point drop, just to kind of put it in perspective, is similar to what we might expect if somebody has lead poisoning. So it's nothing to mess around with. And again, the longer and the heavier that people use, the more likely that effect will be enduring.
Any other comments on cognitive function, or did you want to talk more specifically about the emotional, mental health side of things?
Well, I guess the one other thing I'd say there is that it, it some studies, like this one study from the National Academy of Sciences showed that the impairment is actually global and detectable across all 5 domains of neuropsychological functioning. And so, again, it's not even just IQ, it's about, the ability to function in all neuropsychological aspects. And another scary thing is that another study actually showed that cessation of cannabis use did not fully restore neuropsychological functioning among adolescent onset former persistent cannabis users. And so a lot of times we think like, okay, well, I'll just use for a while heavily, whatever. But again, studies are actually showing that once you lose that IQ, it's hard to get it back. Now, I want to give some hope here. I think that we also talk about neuroplasticity and how the brain can change and improve and all of this. And so I'm not trying to be overly pessimistic. I think especially when we do engage, we realize like, okay, this is harming my brain. I want to make a change here. There are a lot of things that we can do to reverse at least some of that. But
Yeah.
the point is, in my mind, that this is nothing to mess around with, even just for this one reason. And the one other thing that I'll say is that to get that amount of magnitude of negative effect, like the 6 to 8 IQ point drop and the the reduction in functioning in 5 neuropsychological domains, you would probably need to get 2 things: both adolescent onset and 2 decades of persistent cannabis use. Okay, so it is pretty long, right? But again, I think it's a spectrum, and so basically the longer you use, the more heavily you use, the earlier you start, the worse the long-term damage.
And I know 2 decades sounds like a long time, but the social experiment in terms of, I would say, adolescent use or the great degree of adolescent use that we see where people are starting in their teenage years, we're probably, I don't know, maybe 10 years, 15 years, into this particular experiment. So there's a lot of kids that are, my age that are getting close to sort of hitting that 20-year threshold.
Exactly. Yeah. And 20 years can go by fast,
Yeah.
especially.
Especially if you're high all the time.
Yeah, it's so true, and we're saying this kind of laughing, but it's the truth, and it's actually a sad truth. And again, I hesitate to even to say this, but I have a deep, empathy because I've been there without saying too much. In other words, I've tested those waters, and the reason I'm sharing that even with our listeners is because I'm trying to help our listeners understand that even though I have obviously a big bent and leaning towards the dangers of it, a big part of that is because I've seen the dangers even personally in my life and in my relationships and this sort of thing. And so I think it's really important, to even as we do this podcast, that we're not trying to put people down, but it's like, man, we need to really recognize, and when we're in that use and this is the way it was for me, but it was interesting to look at the data. The rationalization actually is a big part of the problem, sure, with any addiction, right? But another big part of the problem is the fact that there's data that actually show that our insight is compromised when we use cannabis. In other words, it's not just that we're denying the fact that it's affecting us, like in our intelligence or our mental health, but there's an element there where we cannot actually see how much it's affecting us. And that's because it compromises part of the frontal lobe that helps with insight. It helps with being able to observe like how something is affecting us. So anyway.
No, it's an interesting point that I've often wondered why so many of my patients that do use cannabis extensively, why it can be such a touchy subject to bring up. You know, people are willing to admit all sorts of other abuses, if you will, but when it came to cannabis in particular, their level of insight seemed to be much more impaired. In terms of the negative outcomes that were likely associated with it. And a big part of that, I just assumed it was in part due to the social acceptance, the relative social acceptance. But it's interesting to hear you talk about the cannabis's effect on insight directly.
Yeah,
it's interesting.
It is fascinating. So yeah, let's talk a little bit about the impact on mental health specifically. And again, just kind of think about this very practically. I have a lot of people that come to me and they'll share, of course, that when I ask them about cannabis use, that they are using, and I ask, well, not for everyone, but oftentimes I'll ask, well, so what are you using it for? Like, you just enjoy it? Like, is it, something that is fun for you or whatever? Or are you using it for a specific purpose? And a lot of people say, no, I'm really using it more for medical reasons. Oh, okay. Well, what medical reasons are you using it for? Primarily, to help with my anxiety, my depression, my ADHD, and my insomnia. Okay, so great. So why are you here to see me? Well, because I have anxiety, depression, ADHD, and insomnia, right? So it's kind of like the Dr. Phil question. How's that working out for you? And the point being, very just practically, just very anecdotally and observationally, again and again, I have never seen cannabis actually be effective for someone's mental health in the long run. Now, does that mean that it never helps anxiety? It never helps depression? It never helps sleep? No, actually, that is not true. In other words, in the short run, it often does help people, just similar to like alcohol. Hey, if you're anxious or, having a hard time falling asleep for another reason, sure, take a couple of drinks and it will knock you out, make you tired after a little while, and you'll be able to sleep, right? But does that mean that alcohol is actually helpful for your mental health and your sleep in the long run? No, it's a temporary fix, but in the long run, alcohol actually will make your sleep problems worse. It'll increase your likelihood of mental health issues, et cetera, et cetera. Same thing with cannabis. It's just a little more subtle, right?
Yeah.
And that's why it sucks people in. And, I think especially I've seen this and there is, pretty good data as far as like the aptitude, like people that have already tend towards ADHD. A lot of these individuals really enjoy cannabis because it actually slows down their mind, slows down their thinking. But again, over time, they have to use more and more, and they're getting a lot of those other negative effects, like on IQ and awareness, and even, other cognitive functioning skills, emotional management skills, that any amount of benefit that the cannabis has in kind of slowing down the overactive brain gets completely overshadowed and offset by these negative effects.
So can you talk to us what some of the research says specifically on, or what the research says in general about specific psychiatric conditions? I know you mentioned ADHD, but there's some good research on some other mental health conditions.
For sure. So the one that I think is probably the most glaring and concerning, there's probably two, but the one that we definitely have the largest body of data on and is the most clear is the impact of cannabis on the increased risk for psychosis. So when we're talking about psychosis, of course, we're talking about delusions. We're talking about paranoia. We're talking about hearing voices, being out of touch with the reality, right? And so what we find as far as cannabis use is that the risk of developing psychosis is about double, roughly, especially if it's a heavy use of cannabis. But there's some people, especially if they're vulnerable and genetically vulnerable to cannabis, or I'm sorry, to psychosis, that even using, once or twice can actually trigger people into a psychotic episode. And it's been super unfortunate, but I've actually had a couple of patients where they started using cannabis and they used for a while, and then they started, having a little bit of that psychosis, and then they ended up in the hospital with psychosis, and then they got better. They came out, they got better, they got past the psychosis. They were on meds and all that, but then they started toying with cannabis again, and then the more you play with fire, the more you get burned. Well, a lot of times what can happen is at first, for maybe a time or two, you can have a psychotic break and recuperate from that, maybe even get off of antipsychotic medication, etc. But if you keep playing with that fire, it can literally trigger a full-blown psychotic disorder, like schizophrenia or something similar, bipolar with psychosis, etc., where you actually develop a psychotic disorder that never goes back to baseline, even if you quit using cannabis.
Yeah. Yeah, I've definitely seen that as well in a few of my patients.
Yeah. And it's just really sad because you realize, like, well, I guess you never know 100% whether they would have gone on to develop it some other way or some other point in their life, but it would have been much less likely, that they would have developed psychosis later on in life. And by the way, an interesting thing there too is, there's even some data that point to the fact that even if somebody never goes on to develop a full-blown psychosis, if you're a heavy, chronic, regular user of cannabis, that because of the very nature of how cannabis affects your brain and your reality perception and reality testing and that sort of thing, there is many people that use cannabis that, again, don't have a psychotic disorder, but because they're chronically using cannabis, have a lot of magical thinking and even some degree of paranoia and out of touch with reality, kind of on the border of that, almost psychosis type experience. And so it's a real concern.
Yeah.
So, and then when we think about, other type of mental health problems, not all of the data is clear as far as causality, but what we do know, so we don't always know, like, oh, definitely marijuana causes like an increased risk of depression or bipolar disorder. So that's not like terribly clear, although most of the data actually point to the fact that, so number one, we know there's a clear association, between cannabis use and depression, cannabis use and bipolar, cannabis use and PTSD and anxiety disorder. But again, we're not completely sure which direction that is. Is it the chicken or the egg? But again, what we do know is that some of this research points to, like, as far as like bipolar disorder, for example, even if it's not causative in that bipolar disorder for that particular person, when people have bipolar and then they use cannabis on top of that, that the outcomes tend to be worse for that individual as far as their ability to function and what have you. So, and one of the biggest concerns that we find from the data is that there is research that actually suggests that that it can likely increase suicidal behaviors like completed suicide attempts, and suicidal ideation, which is obviously the worst possible outcome. And so we really want to be careful with this, realizing that, cannabis, even though it might seem like, oh, it's not that bad, it's not as bad as alcohol, blah, blah, blah. there's some real risk involved here, especially when I think about how much of a burden a psychotic disorder can be, or, suicidal ideation, or of course, suicide attempts, bipolar, etc. Those are big things to consider.
Now, what about pain, Dr. Binus? Because I know a lot of patients, might be coming in for many of those reasons you sort of outlined above, in terms of anxiety and sleep and appetite and so on. But I do have an increasing number of patients, and I'd say more so older populations, right, that are using this for pain, especially with, and many of their reasons, or it's widely accessible, and many of the pain medications that maybe they've used or have tried to use are becoming increasingly more restrictive. So, what sort of data do we see for pain use?
Yeah, so basically, there's some people that will say there is substantial evidence that cannabis or cannabinoids are effective for the treatment of chronic pain in adults. However, I would be a little careful with this data because, in my mind, it's still not based on good longitudinal, objective, uh, perspective data. So there was one study that was actually done in 2018 that was a 4-year prospective cohort study. And this was on cannabis and chronic non-cancer pain. Okay. And this is probably the longest, at least up to that time, in-depth prospective study. And it was done on a community cohort of people. And basically, it was examining the effects of cannabis use on pain and prescribed opioid use. Okay, so they wanted to look at the effect on pain, and then also how much, if that decreased or increased the amount of opioids people were using. And I believe the study was done in Australia, but it's found in the Lancet Public Health Journal in 2018. And so there were over 1,500 participants in the study, and cannabis use was common. By 4-year follow-up, about 24% of participants had used cannabis for pain. What was interesting is that the 4-year follow-up, compared with people with no cannabis use, we found in the study that participants who used cannabis had a greater pain severity score, and a greater pain interference score as far as their pain interfering with their daily functioning. Participants also had lower pain self-efficacy scores and greater generalized anxiety disorder when they were using cannabis. And there was no evidence that cannabis actually reduced prescribed opioid use or increased rates of opioid discontinuation. So, the authors interpreted this study, and they said, cannabis use was common in people with chronic non-cancer pain who had been prescribed opioids, but we found no evidence that cannabis use improved patient outcomes. People who used cannabis had greater pain and lower self-efficacy in managing pain, and there was no evidence that cannabis use reduced pain severity or interference or exerted an opioid-sparing effect. So there you have it.
Interesting.
Yeah, I mean, I thought it was pretty profound because, again, this was a prospective cohort study and a pretty large sample size. And, I know it's just one study, but it was a pretty good study. And it actually seemed like in the long run, it worsened things for people.
So maybe kind of similar to going back to what you were saying previously about, its effect on anxiety and sleep and so forth, where there may be some apparent short-term benefits, but in the long term, the body's inability to regulate itself and its own system, be having a significant downstream effect where you almost get the opposite effect in the long term.
Exactly. Yep. And so, one of the things that I do want to bring up as we are getting ready to wrap it up here is that I'm not trying to demonize cannabis and certainly not people that use cannabis. I have actually a real soft spot in my heart because I understand, that struggle myself, like I mentioned earlier. Um, but I'll say there's a reason that people use cannabis. In other words, the reason is, and I'd say almost across the board, sure, maybe you have your rare occasion where it's just, oh, it's just fun. But even those people that think, oh, it's just fun, it's actually almost invariably to treat pain. And what I mean by that is not just physical pain, but some kind of psychological, emotional pain. And so, if we're like feeling like we're drowning and all we have is a piece of driftwood, then guess what? We got to grab onto that piece of driftwood and hang on for dear life. And I think that's what, for a lot of people, the cannabis is kind of like, it's like, hey, you know what? I'm drowning here. I need something to help me to sleep or to, numb the pain from depression or anxiety. And cannabis kind of helps with that. So look, if you're in that boat, I don't blame you. I understand, what that's like. At the same time, if we're there, struggling and feeling like we're drowning, and a boat comes by, it's like, you know what? Let go of that piece of driftwood and get into that boat, because there's better ways, to deal with drowning than just hanging on to this piece of driftwood and barely surviving and sometimes being nibbled on by sharks, So we actually, so the point being is like, we got to think beyond this and say, okay, how could I actually treat the pain in a more effective way that will truly be helpful in the long run? And we need to also think that way, not just ourselves if we're using, but also with people. We need to have compassion. The people that are struggling with cannabis use, we need to have compassion. We need to not be judgmental or critical. Yes, we need to inform and not enable, but we need to say, hey, look, you know what? There's actually better ways that will to address the anxiety, to address the depression, to address the ADHD, etc. And as we're offering better solutions, now it's like the need for, the cannabis actually reduces more and more, and then people can actually start living and being a lot healthier, happier, and fulfilled. And that's really the way it's been even in my life too, and I'll just say that in closing is that, I didn't realize the impact it was having on my life until several months into being away from it. But my life has completely changed and altered for the better since. And thank God that was years and years and years and years ago, just to be clear. But at the same time, it's a huge difference. It's a game changer. And I want to invite and encourage our listeners, again, if you have someone that you're struggling, or somebody that's struggling, let's encourage one another. Let's realize there is a better way. And let's try to get the support, the help, or support those people that we know that need that help. And through that process, we can actually find a much better life.
Well, I don't think I can say it any better than that, Dr. Binus. So I'll leave it with that. But I imagine many of our listeners will have found this discussion convicting, inspiring, hopefully. And if you yourself are struggling with this, find somebody that understands or works with individuals and can give you really good quality alternatives for a healthier thriving. With those mental challenges you might be masking the cannabis with. And if it's not you, but it's a family or friend, please share this information with them so that they can benefit from it. So thank you for listening today, and we hope to see you again next time.
All right. Thank you, Jonathan.
Absolutely.
Thanks for listening. If you enjoyed today's episode, please like and subscribe. Your engagement will help us reach more people who need encouragement. To hear more episodes, learn about our other mental health resources, or support us financially, visit thebrainpeoplepodcast.com.